Are you delusional? Do you suffer from a mental illness?
I am a trans woman and I have a cisgender girlfriend. We are in a lesbian relationship and we absolutely love each other.
Delusions are a symptom of psychosis. They involve strong beliefs in something that is not true.
I am a robot or android of sorts. I am not human.
The definition of a delusion is a fixed false belief.
Hey y'all, do trans girls get periods? They definitely do.
So if I consistently insist that I am Margaret Thatcher,
I am a Muslim woman.
Or consistently insist that I am a cat.
Some men have vaginas. Some women have penises.
Or I'm an amputee trapped in a normal body, I am delusional.
Hi, my name is Avosha, and I'm a 45-year-old transgender pansexual lesbian woman.
That doesn't make sense.
I am this weird amalgamation of like genders and vibes and essence and just being that I literally cannot define. I don't know. You're just gonna have to take my word for it. It's like the universe. It's like ever flowing. There's like...
You're delusional, and your demonstration is meaningless.
Essentially, transgender ideology holds that people can be born into the wrong body. It's simply not true.
Genitalia does not define gender.
Well, that doesn't add up.
Moreover, during prenatal development, when you get to about 8 weeks gestation, that's when your male fetuses, your male unborn children at 8 weeks, have testicles that begin secreting testosterone. So their brains are further masculinized. So they're masculine first by genetics, and then second by this extra endogenous testosterone that girls don't have.
I want to be a woman. From now on, I want you all to call me Loretta.
I am a woman because I say that I am a woman. What is or is not between my legs is absolutely irrelevant.
Gender identity, all identities, they're in our thoughts. Thoughts and feelings, those are not hardwired, they develop, and they may be factually wrong or factually correct.
And I am definitely a man, a woman. I am both simultaneously at the same time.
Drop this ridiculous facade and offer the truth.
Human sexuality is binary. Okay, we know this because in nature, reproduction is the rule. And human beings, we engage in sexual reproduction. You need a man and a woman to do that.
You can prove this to yourself through a thought experiment. Start with yourself as a fertilized ovum and work your way backwards. You'll find a sperm coming from a male and an egg coming from a female. And this is true of 100% of cases, now and forever in the past and forevermore.
Can someone please tell me what's going on?
We are manufacturing deeply wounded children. That's the bottom line.
I speak to you today as a victim of one of the biggest medical scandals in the history of the United States of America. I speak to you in the hope that you will have the courage to bring the scandal to an end and ensure that other vulnerable teenagers, children, and young adults don't go through what I went through.
What is all this predicated on? Something called gender identity. This was defined in a court case as a person's core internal sense of their own gender. What's interesting I found in this case is they said that this gender identity is the primary factor in determining a person's sex. This is an ongoing case, and not biology. That's incorrect.
We used to think, all the differences between men and women, they're only located on the Y chromosome. No. Men and women have at least 6,500 shared genes that are expressed differently in virtually every tissue of our bodies, including the brain.
What is gender dysphoria? It's a mismatch between a person's physical sex and their mind's perception of that sex.
You know what I don't get is why people still see me as a woman. What more could I be doing? I literally cut my titties off.
And this is a real condition, and these kids, of course, deserve all the care and attention and love in the world. But we're concerned about medicalization. Most of these kids, as Ryan said, will actually grow out of this condition either through watching and waiting or help from a therapist or psychologist.
The 8-year-old girl was being bullied because she's essentially a tomboy. So the doctor said to her, well, so are you a boy or a girl? The 8-year-old looked at her body, looked back, a girl. The doctor said, oh, well, do you like Pop-Tarts? Yeah, I love Pop-Tarts. Well, if I gave you a Pop-Tart that was in a strawberry wrapper and you took a bite and it tasted like blueberry, what kind of Pop-Tart is it really? Blueberry? And there was a pause, and then the little girl's eyes got big. She looked at her mother and said, Mommy, I think I'm a boy in a girl wrapper. And that child is now in the LA Children's Gender Clinic on puberty blockers set up for cross-sex hormones.
There is no objective test to diagnose this, yet we're giving very harmful therapies on the basis of no objective diagnosis.
And this doctor said to her audience, now, I didn't tell him he was a boy. I just gave him the words he didn't have. We have to give children the language to express what's going on in their minds.
My name is Prisha Mosley. I was 15 when I began my social transition with a legal name change of hair and clothes, and by binding my breasts. Even social transition is dangerous, and step 1 caused permanent damage to my back and ribs.
There is nothing more anti-science than saying a girl brain can be trapped in a boy body.
What about using this medication for stopping normal puberty, say at 12 or 8? This is an off-label, untested, experimental use. It hasn't been through any FDA approval process. It's what I would call a chemical conversion therapy.
The AAP's policy completely ignored the fact that the vast majority of children will outgrow this by the time they pass through natural puberty. So if we block puberty with drugs in these children, we are denying these children the developmental phase during which most change their minds.
This is what I look like. This is what I sound like as an almost 30-year-old man. This is what happens when you let people transition in adolescence before they've had a chance to grow up. Not just let, but pressure. The active pressuring of people to transition so they can preserve their femininity, which is what happened with me. I was told that if I allowed myself to age, that I would become masculine and that it would never be possible and that I would do it anyway, and that I would be a more masculine transgender person like them.
And are there side effects from this? Of course there are. Both sexes have shown increased risk of myocardial infarction, death due to cardiovascular disease. That's males taking this estrogen, females taking testosterone. With the male, 5 times increased risk of deadly blood clots, 2 times increased risk of stroke. Females also been shown with liver dysfunction, hypertension, potential for cancer of the ovaries or breast.
3 things I wish I knew before I transitioned to male. 1, that injecting myself with cross-sex hormones actually was harming and damaging my perfectly healthy body.
Testosterone was injected into my anorexic body by a pediatric endocrinologist in the same hospital where I was seeing a nutritionist for my severe eating disorder and receiving stitches for cutting.
I traded my perfectly healthy genitals for an artificial 1-inch tunnels that is sexually non-functional. I realized that I'm never getting back a functional penis, and full detransition is not really possible in my case. I feel stuck in surgically created body.
You're going to disrupt the normal brain development that's happening with the sex-based hormones. It actually disrupts normal bone development because the sex hormones are important, so osteoporosis is a future risk.
Moreover, my back hurts every day due to osteoporosis and scoliosis that I developed post-SRS. I'm now dependent on synthetic hormones for life.
Especially when it comes to medical consequences. There was like a list of that, the incontinence, not being able to hold your bladder, not being able to sleep because of heat flashes that are painful. It's ridiculous thinking that a teenager should go through that.
There are also neuropsychological effects. You can go yourself and look up the side effects of, say, Lupron. You'll see emotional lability, nervousness, anxiety, delusions. It even says monitor for development of worsening of psychiatric symptoms. Used with cautions in patients with a history of psychiatric illness. I've already said many of these adolescents have neuropsychiatric conditions.
Taking hormones actually worsened my mental health, but therapists saw that it was because I was stuck in the wrong body. They cleared me for sex reassignment surgery by diagnosing me with gender identity disorder.
I already had pre-existing diagnoses of OCD, anorexia, anxiety, depression, and borderline personality disorder when I saw my WPATH certified gender therapist at 17 years old.
2. That changing my identity and changing my body wasn't actually going to heal the pain I had within myself. It was just an escape that created actually more trauma for me.
In my early 20s, I had substance use disorders and mental health issues. I transitioned from male to female. I lived my life as a transgender woman for close to 10 years. I detransitioned upon sobering up.
Individuals with disorders of sex development are being used as pawns.
Social media and YouTube and things like that, binge watching YouTube videos of transitioners seem to be playing a role. Contagion seems to be playing a role.
My trauma and mental illness made me susceptible to 2 social contagions. It started with anorexia and was followed by gender ideology. The difference is that my anorexia was not affirmed by my doctors or the adults around me, but my trans identity was. I was denied liposuction at the same time that my breasts were cut off. Teenage girls are a demographic known for falling victim to social contagions. Please protect others from becoming permanent medical patients like me.
Earlier this year, after hitting rock bottom with my depression, I reached out to a new therapist. This therapist helped me realize that I have complex PTSD from a traumatic childhood, and also pointed out that I have body dysmorphia, OCD, borderline personality, and bipolar disorders. I also realized I had internalized homophobia.
And so I made the choices that I thought were right for me at the time. I did it in secret from my parents. I take accountability for all of my choices, but when is the trans community going to take accountability for theirs?
The trans community found me vulnerable and naive and convinced me that I had been born in the wrong body. They told me I needed a letter of recommendation which would unlock hormones and surgery. So I went online without my parents and found the therapist who wrote me my letter in one 15-minute appointment.
I realize now that medical transition was sold to me as a hardware fix for software issues.
And getting to see a psychologist that was not an activist. I think a lot of society, and especially the trans rights movement, detransition is a reality that they're not ready to see or face or accept quite yet.
The gender clinic presented my parents with the classic false dichotomy regarding children with gender dysphoria. Would you rather have a dead daughter or a living son?
And unfortunately, it is a tyranny from the top, because these physicians I've been talking about, they are in positions of power. They determine the standards of care. They determine what gets taught, and it filters down.
How did we get to the point where nearly every pediatric institution in the country considers it best practice to remove the healthy breast tissue of children while administering drugs typically used to chemically castrate high-risk sex offenders?
This whole thing is an experiment on children. We're ignoring the voices of desisters and people who have come out of this and recognize their sex. And the NIH is allowing unethical research to be conducted on children and adolescents, in my opinion.
That is all I have for today. Please like and subscribe. And please support this channel by downloading my book, The Ministry of Truth, How Propaganda Fuels the Culture War. And join me again tomorrow as we learn how to survive woke land together. Until then, this is Ethan Quinn saying, stay free.